I'd like to start the video off with a movie and finish it off with a movie. If you like, you can fast forward.
Now, there was a secret chord that David played and it pleased the Lord. But you don't really care for music, do you? It goes like this: the fourth, the fifth, the minor fall, the major lift, the baffled king composing hallelujah. Yes, and Jesus was a sailor when he walked upon the water, and he spent a long time watching from a lonely wooden tower. And when he knew for certain only drowning men could see, he said, all men will be sailors then, until the sea shall free them. He himself was broken long before the sky would open, forsaken, almost human. He sank beneath your wisdom like a stone. And you want to travel with him, you want to travel blind, and you know you will trust him, for he's touched your perfect body with his mind. Everybody knows that the dice are loaded. Everybody rolls with their fingers crossed. Everybody knows the war is over. Everybody knows that the good guys lost. Everybody knows the fight was fixed. The poor stay poor, the rich get rich. That's how it goes. Everybody knows. Everybody knows that the boat is leaking. Everybody knows that the captain lied. Everybody got this broken feeling, like their father or their dog just died. Everybody talking to their pockets. Everybody wants a box of chocolates and a long stem road.
Metastatic bowel cancer, Folfox treatment. The treatment cycle is repeated every 14 days. Day 1, oxaliplatin. How it's given by drip into a vein, about 4 hours in the clinic. Day 3, disconnect pump. That's about 30 hours in the clinic. The pump goes into a vein into the port near your heart. For 2 days, about 46 hours by pump at home. That's a week. The treatment cycle is repeated every 14 days. Anti-cancer drugs used to treat cancer can sometimes cause serious problems. It's important to get medical help immediately if you become unwell. Immediately go to your nearest hospital emergency department or contact your doctor if you have any of the following: Go to the emergency department at Westmead Public Hospital or a jug. A temperature of 38 degrees Celsius or higher. Chills, sweats, shivers or shakes. Shortness of breath. Uncontrolled vomiting or diarrhea. Pain, tingling or discomfort in your chest or arms. Leaking from your pump. You become unwell. During your treatment, immediately tell the doctor or nurse looking after you if you get any of the following treatment. Looking after you, yeah, good luck with that. Leaking from the area where the drugs are being given. Pain, stinging, swelling or redness in the area where the drugs are being given at any injection sites. Skin rash, itching, feeling short of breath, wheezing, fever, shivers, feeling dizzy or unwell in any way. Allergic reaction. Sometimes the treatment may be started at a lower dose or the dose needs to be changed during treatment. There may also be times when your treatment is delayed. This can happen if your doctor thinks you are likely to have severe side effects. If you get a severe side effect, if your blood counts are affected and causing delays in treatment, or if you're finding it hard to cope with the treatment, this is called a dose reduction, dose change or treatment delay. Your doctor will explain if you need any changes or delays to your treatment and the reason why. That's if you don't drop dead or get another blood cancer from it. Chemotherapy can reduce the number of blood cells in your body. You'll need to have regular blood tests to check that your blood cell count has returned to normal. If your blood count is low, your treatment may be delayed until it has returned to normal. Your doctor or nurse will tell you when to have these blood tests. Tell your doctor if you are on an anticoagulant medication to prevent blood clots, e.g. warfarin. You may need to have additional blood tests. The treatment involves having chemotherapy through a pump. To have this, you will also need a central venous access device. Your doctor or nurse will explain this to you. At home, you will need to look at your pump 3 to 4 times a day to check it is working. Your nurse will teach you how to do this. You should avoid cold drinks, cold food and ice on the day of and for up to 2 days after treatment with the chemotherapy. If you have cold food or drinks, you may get discomfort or tightness in the back of the throat or the feeling like you cannot breathe or swallow. Other medications during this treatment: anti-sickness, anti-nausea medication. You may be given some anti-sickness medication. Make sure you take this medication as your doctor or nurse tells you. Even if you don't feel sick, this can help to prevent the sickness starting. Good luck with that one. Anti-diarrheals. You may be given some medication to treat diarrhea. Wow. Your doctor or nurse will tell you how and when to take the anti-diarrheal medication. The side effects can cause damage to normal cells in your body, which can cause side effects. Chemotherapy treatment can cause damage to normal cells, which can cause side effects. Everyone gets different side effects, and some people have more problems than others. The table below shows some of the side effects you may get with this treatment. Tell your doctor or nurse about any side effects that worry you. Good luck with that one. Allergic reactions are uncommon but can be life-threatening. If you feel unwell during the infusion or shortly after it, get a fever, shivers or shakes, feel dizzy, faint, confused or anxious, start wheezing or have difficulty breathing, have a rash, itch or redness of the face while you are in the hospital, tell your doctor or nurse immediately. After you leave, contact your doctor or nurse immediately or go to the nearest hospital emergency department. Dr. Mi Ling, and see Dr. Chris Cheeseman and Mi Ling, and they'll look after you like they did to me. Breathing or swallowing, you might get discomfort or tightness in the back of the throat or the feeling like you cannot breathe or swallow. This can happen during infusion and for up to 48 hours after. These symptoms are temporary, they can be distressing, but they are not usually harmful and will disappear. Really, if symptoms develop, cup your hands over your mouth and breathe normally. The warm air will help relieve the feeling. Wow. Avoid cold temperature, cold drinks and ice cubes before having it. Chemotherapy and for 2 days after, as this can increase the risk. Tell your doctor or nurse as soon as possible if your symptoms don't go away. Wow. Heart problems, you may get chest pain or tightness, shortness of breath, an abnormal heartbeat. Tell your doctor if you have a history of heart problems or high blood pressure. Tell your doctor or nurse immediately or go to the nearest emergency hospital department. Yeah, as if. You may feel sick, nausea, or be sick vomiting. Take your anti-sickness medication as directed. Even if you don't feel sick. Oh, that horrible Premin, eh? Yeah, I prefer to take something else than that, something natural. Plenty of drink of fluids unless you are fluid restricted. Eat small meals more frequently. Yeah, you'll eat small meals, all right. Try food that does not require much preparation. Try bland foods like dry biscuits or toast. Wow. Gentle exercise may help with nausea. Nausea and vomiting during cancer treatment. Yeah, I take the ginger. Ginger, just chew on that. You don't need to take that Premin rubbish. This is disgusting, all of this. Tell your doctor or nurse immediately or go to the nearest hospital department if you have uncontrolled vomiting or feel dizzy or lightheaded. Yeah, right, no, Westmead Public Hospital Emergency Department. The Death Factory, I call it. Many others do too, the worst hospital in Australia. You may find that food loses its taste or tastes different. Well, of course you will. These changes are likely to go away with time. Yeah. Do your mouth care regularly. Chew on sugar-free gum or eat sugar-free mints. Add flavour to your food with sauces and herbs. Oh, good luck. Taste and smelling changes through treatment. Too right it does. You don't feel like eating nothing. Infection, the treatment lowers the amount of white blood cells in your body. The type of white blood cells that help to fight infection are called neutrophils. They have low level of neutrophils is called neutropenia. If you have neutropenia, you are at greater risk of getting an infection. It also means that your body can't fight infections as well as usual. This is a serious side effect and can be life-threatening. Wash your hands often, keep a thermometer at home and take your temperature regularly. And if you feel unwell, do your mouth care regularly. Inspect your central lines site daily. If you have any redness, pus or swelling. Limit contact with people who are sick. Learn how to recognise the sign of infection. Ask your doctor or nurse for infection information about treatment. Tell your doctor or nurse immediately or go to the nearest hospital department, emergency where signs of temperature of 38 Celsius or higher. Yeah, bullshit. Not Westmead Public Hospital. The Death Factory: chills, shivers, sweats, shakes, sore throat, uncontrolled diarrhoea, shortness of breath, fast heartbeat, become unwell without temperature. Geez, I love this Folfox. This treatment lowers the amount of platelets in your blood. Oh, that's handy. Platelets help your blood to clot. When they are low, you're at an increased risk of bleeding and bruising. Try not to bruise or cut yourself. Avoid contact sport or vigorous exercise. Clear your nose by blowing gently. Avoid constipation. Brush your teeth with a soft toothbrush. Don't take aspirin, ibuprofen or similar anti-inflammatory medications unless your doctor tells you to. Tell your doctor or nurse if you have any bruising or bleeding. Tell your doctor or nurse immediately or go to the nearest hospital emergency department if you have any uncontrolled bleeding. That'd be right. Diarrhoea: you may get bowel motions, stools, poo that are more frequent or more liquid. You may also get bloating, cramping or pain. Take your anti-diarrheal medication as directed by your doctor. Drink plenty of fluid unless you are fluid restricted. Eat and drink small amounts more often. Avoid spicy foods, dairy products, high fibre foods and coffee. Ask your doctor or nurse for information about the diarrhoea during cancer treatment. Tell your doctor or nurse immediately or go to the nearest hospital emergency department if your diarrhoea is not controlled. If you have 4 or more loose bowel motions per day, if you feel dizzy or lightheaded, go and see Dr. Mee Ling and Dr. Chris Cheeseman in Westmead Public Hospital. They'll fix you up. Tired and lack of energy: you may feel very tired, have no energy, sleep a lot and not be able to do normal activities, things you enjoy. Yeah, that's a given. Do not drive or operate machinery if you're feeling tired. Nap for short periods, only 1 hour at a time. Prioritise your tasks to ensure the best use of your energy. Eat a well-balanced diet and drink plenty of fluids unless you are fluid restricted. Try some gentle exercise daily. Allow your friends and family to help. Tell your doctor or nurse if you get any of the symptoms listed above. Well. Too easy. Mouth pain, soreness, mucositis. You may have bleeding gums, mouth ulcers, a white coating on your tongue, pain in the mouth or throat, difficulty breathing or swallowing. Avoid spicy, acidic or crunchy foods and very hot, cold foods and drinks. Try bland and soft foods. Brush your teeth gently with a soft toothbrush after each meal, and at bedtime, if you normally floss, continue to do so. Rinse your mouth after you eat and brush your teeth using either a quarter teaspoon of salt in 1 cup of warm water, or 1/4 teaspoon of bicarbonate of soda in 1 cup of water. Ask your doctor of mouth problems during cancer. Tell your nurse or doctor or nurse if you get any of the symptoms listed above. Your skin may become dry and you may notice changes to areas of your skin that have been exposed to the sun. Keep your skin moisturised with a cream such as Sorbolene or aqueous cream. Avoid direct sunlight. Protect your skin from the sun by wearing a wide brim hat, sun protective clothing, sunglasses, sunscreen of SPF 30 or higher. Tell your doctor or nurse if you notice any skin changes. You may get eye pain, red, sore or swollen eyes, blurred vision, water or gritty eyes, changes in your eyesight, sensitivity to sunlight. Protect your eyes from the weather, sun and wind by wearing sunglasses, especially if you have lost your eyelashes. Well, that's tell your doctor or nurse if you get any of the symptoms listed above. Eye drops may help with your symptoms. The palms of your hands and soles of your feet may become red and hot, swollen, painful, tender, blistered. The skin in the area may also peel. Moisture your hands and feet daily. Moisturise your hands and feet daily with Sorbolene and aqueous cream. Keep your hands and feet clean and dry. Avoid hot water. Instead, use lukewarm water to bath. Avoid direct sunlight. Avoid unnecessary walking, jogging or exercise. Wear cotton socks and avoid tight-fitting shoes. Tell your doctor if you notice any skin changes on the feet, hands or feet. After being out in the sun, you may develop a rash like a bad sunburn. Your skin may become red, swollen, blistered. Avoid direct sunlight. Protect your skin from the sun by wearing sun protective wide brim 30 SPF. We said that. Tell your doctor or nurse if you get any symptoms. Well, you may notice a change in the sensations in your hands and feet, including tingling of pins and needles, numbness or loss of feeling pain. You may find it difficult to do everyday activities such as doing up buttons or picking up small objects. Test water temperature with your elbow when bathing to avoid burns. Use rubber gloves, pot holders and oven mitts in the kitchen. Wear rubber shoes or boots when working in the garden or garage. Keep rooms well lit and uncluttered. Ask your doctor for information. Nerve problems during cancer treatment. Yeah. Tell your doctor or nurse if you're getting any symptoms. You may feel dizzy, lightheaded, tired and appear more pale than usual. Tell your doctor if you have any of these symptoms. You might need a blood transfusion. Or, if immediately go to Westmead Hospital emergency department. If you have chest pain, trouble breathing, or feel like your heart is racing. Low blood cells, that's called anemia. Your hair thinning, you may become dry and may break. Your hair may become dry and break easily. You may lose some of your hair. Use a gentle shampoo and soft hairbrush. Take care with hair products like hairspray, hair dye, bleachers and perms. Protect your scalp from the cold with a hat or scarf. Protect your scalp from the sun with a hat and sunscreen SPF 30 or higher. Ask your doctor or nurse about the Look Good Feel Better program. Look Good Feel Better program, hey? Gee, that sounds good. www.lgfb.org.au. Yeah. Another gimmick, your nails change. Your nails may grow more softly, become darker, develop ridges, white lines, become brittle and flaky. In some cases, you may lose your nails completely. Keep your nails clean and short. Avoid things like biting your fingernails, getting a manicure, pedicure, or false nails. Wear gloves when you wash your dishes, work in the garden or clean the house. Skin colour changes. You may have darkening of your skin, especially in areas that are exposed to the sun. You may also have noticed darkening of your tongue, gums and over your finger joints. These changes may fade over time, eh? Use a skin protection, HP 30. Learn how to keep you and your family safe while you are having chemotherapy. See our information sheet. Chemotherapy safety in home. Blood clot. Cancer, chemotherapy drugs can increase the risk of blood clots, thrombosis. Tell your doctor or family if you have a family history of blood clots. Page 7. A blood clot can cause pain, redness, swelling in your arms or legs, shortness of breath or chest. If you have any of these symptoms, go to the nearest hospital and emergency department. In this case, Westmead Public Hospital, Dr. Mi Ling and Chris Cheeseman, they'll sort you out like they did with me. Medications and vaccination. Before you start treatment, tell your doctor about medications you are taking, including vitamins, herbal supplements. Don't start any medications during treatment without talking to your doctor and pharmacist first. Paracetamol is safe to take if you have a headache or other mild aches and pains. It's recommended that you avoid taking aspirin, ibuprofen and other anti-inflammatory type medication for pain while you're having chemotherapy. However, if these medications have been prescribed by your doctor, do not stop taking them without speaking with your doctor. Vaccinations such as flu, tetanus are safe to receive while having treatment. Do not have any live vaccines during your treatment or for 6 months after if you are unsure. Check with your doctor first. I'm not too sure about the COVID vaccine. I understand it comes from a monkey flu virus. I don't know if that's live. People who live with you should be fully vaccinated, including having live vaccines according to the current vaccination schedule. Extra care needs to be taken with hand washing careful that who have recently received the rotavirus vaccine. If you go to hospital or any other medical appointment, including dental appointment, always tell the person treating that you are having chemotherapy. Before you have any dental treatment, talk to your doctor. Diet, while you are receiving this chemotherapy treatment, it's important that you try to maintain a healthy diet. Speak to your doctor or nurse about whether drinking alcohol is safe with your equipment. Don't worry, you won't be drinking that. If you have any concerns about recent weight loss or weight gain, about your diet, ask to speak to a dietitian. Oh, yeah, that's a good idea. Fertility. Some cancer treatments can reduce your fertility. This can make it difficult or impossible to get pregnant or father a child. Talk to your doctor or nurse before you start chemotherapy treatment. Depending on the situation, maybe fertility-sparing options available to you and your partner, wife, or whatever you would discuss with your doctor. I don't know if they're a gay couple, how they go. Pregnancy and breast testing. Some cancer treatments can be dangerous to unborn babies. Talk to your doctor or nurse if you think there's any chance you could be pregnant and taking chemotherapy. Do not try to get pregnant or father a child during chemotherapy treatment. Ask your doctor or nurse what type of contraception you should use. Do not breastfeed if you're on this treatment, as chemotherapy can also pass into the breast milk. The desire to have sex may increase as a result of this treatment of its side effects. You might have Viagra in it. Your emotions and the way you feel about yourself may also be affected by this treatment. Wow, little wonder. I help to discuss your concerns with your partner or two men and two women or partner in the business, doctor or nurse. Quitting smoking, never been too late to quit smoking. Quit smoking is one of the best things you can do to help your treatment work better. There are many effective tools for your chance of quitting smoking. Talk to your treating team for information for smoking cessation support. Yeah, I've seen people in palliative care there on the bed out in the courtyard smoking cigarettes at St Joseph Hospital, Auburn. Staying active, research shows that exercise, no matter how small, has many benefits for people during and after cancer treatment. Talk to your doctor before starting an exercise. Your doctor can advise you when you need a modified exercise program. Good luck with that. For more information about cancer treatment, side effects in cancer, side effect management, see our patient and carers section. Where to get more support, telephone and patient information, bowel cancer, metastatic. That sounds like a load of crap. What do I make of it? Oh, they've got a cancer call centre, 13 11 20, for cancer information. Good luck with that one. Australian Cancer Stoma Association information, Australian Government, bowel cancer, Government, National Public Toilet, bowel cancer, all the information you want. Cancer, Beyond Blue, Cancer Australia, Cancer, canteen.org.au, Carers Australia. Oh, my, too many. Radiation oncology, targeting cancer, red card. Quit smoking hotline, hit quit line, 1378. It's pretty obvious that if I had taken this, I'd be dead now. And it kills you on the first stage. It can give you another cancer, blood cancer, and horrendous life. And what's the gain that Professor Nagriel was seeking? At that point of time, December 16, 2020. It's not a cure, this foal, folks. It's just to give you another eight or 9 months more life, life extra. Well, look, if I had taken that, I wouldn't be where I am now. Eating really well, walking 3-4 kilometres, got my own movie production going, got a bit interesting in life, happy in life. And he wanted me to take that. I mean, that's just outrageous. How could you justify that, giving that to someone, old person with metastatic cancer, and then suffer like hell like all of that? I've seen people suffer, so that's Bradley Hazzard, the New South Wales Health and Research Minister. Better get off his lazy fat ass and do some research about chemotherapy amongst things. Okay, thanks for listening.
There was a secret chord that David played, and it pleased the Lord. But you don't really care for music, do you? It goes like this: the fourth, the fifth, the minor fall, the major lift, the baffled king composing hallelujah. Yes, and Jesus was a sailor when he walked upon the water, and he spent a long time watching from a lonely wooden tower. And when he knew for certain only drowning men could see, he said, all men will be sailors then, until the sea shall free them. He himself was broken long before the sky would open, forsaken, almost human. He sang beneath your wisdom like a stone. And you want to travel with him, you want to travel blind, and you will trust him, for he's touched your perfect body with his mind. Everybody knows that the dice are loaded. Everybody rolls with their fingers crossed. Everybody knows the war is over. Everybody knows that the good guys lost. Everybody knows the fight was fixed. The poor stay poor, the rich get rich. That's how it goes. Everybody knows. Everybody knows that the boat is leaking. Everybody knows that the captain lied. Everybody got this broken feeling, like their father or their dog just died. Everybody talking to their pockets. Everybody wants a box of chocolates and a long stem road.
God bless us all.